Hey folks, welcome to DocTalk. We have a very, very exciting show. We're at Enso Discoveries in Manhattan, Kansas. You can see that we're working on stem cells for horses, dogs, cats, you name it, they got it. This is going to be a great show.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Hey folks, welcome to DocTalk. I'm here with Dr. Corey Harava, and we're here at Enso Discoveries where there's some pretty incredible stuff going on.
I think so. We try to stay on the cutting edge. We're in the world of regenerative medicine. So platelet-rich plasma, platelet-rich fibrin, growth factor, stem cells.
So we hear a lot about, you know, obviously we're seeing this in athletes, we're seeing this in different types of human medicine, and now we're expanding this on into equine and companion animal medicine. And
yeah, interestingly, it actually started in veterinary medicine. Veterinary medicine started ahead of the human side by probably about 5 or 6 years.
Really?
But now what's happened is, yeah, the human side was more kind of behind closed doors research. Now all the data is coming out and it's becoming much more mainstream on the human side. People look back for the original data and they're like, hold on, you've got studies published in a dog from 10 years ago.
right.
And not just like a lab animal dog, but actual dogs that belong to pets.
Yeah.
Yes, exactly.
All right. Well, tell me a little bit. Tell me some of this, the history. Tell me some of the, you know, the background and because you know we hear it and people are like, oh, you know, I don't. If you don't understand something, you fear it, right?
Exactly.
And
That's
so it's something that we try to pride ourselves on. DocTalk is how can you cookbook this down to tell me where it started and where we're at and what it does.
The first thing is to separate is embryonic versus adult stem cells.
Okay.
They're so different that some people don't even call them both stem cells. So first in embryonic stem cells, we all know that's an embryo. We start off as one cell, a fertilized egg, and we're trillions of cells. And so in embryonic stem cells, its purpose is to go from 1 to trillion. And it does it. We have 2 eyes, 2 ears, 2 arms. It does it in a symmetrical fashion. So when you have, imagine if you have an embryonic stem cell, it's a clump of cells. It's almost like a cluster of grapes.
Yep.
Those cells start to stretch out linear. One goes towards the head, one goes towards the tail. And as you're probably aware, we had tails in the womb when we were really young. So those cells are surrounded by neighbors that tell them what to do. So when one's going towards the head, one's going towards the tail. The ones in the middle can recognize that they pick up signals from their neighbors so they know where they are. When we use those in the body, though, in an adult body, if we take an embryonic stem cell out and put it into your liver or your hip joint, we have problems. That stem cell reverts to its original programming, which is to make an organism, to make a being. And when they do, they kind of panic. I call it stem cells gone wild. This is like an ADHD kid in a candy store without parental supervision. Good things don't happen. And what they do is they try to make a being, an organism, and they make a teratoma. And a teratoma, as you're aware, is a tumor which has teeth, hair, nerves, because it's a cell trying to do that. It's trying to make a whole body.
Yep.
It's not a malignant tumor, but it's still, nobody wants that anywhere in your body. So that's what an embryonic stem cell. Every other tissue in our adult bodies, and even from fetuses, those cells are now, we call them adult stem cells, and some people call them adult stromal cells because they're so different. If you take an adult stromal cell or an adult stem cell and put it into your liver, your hip, or wherever, it does not turn into a tumor. It has because you're formed as a being. It doesn't need to reform you. It has a different role. It has 2 main jobs. One is keep what you got. You've heard of the statistic of house dust. A lot of house dust is made up of exfoliated skin.
Yep.
We're constantly, dander. We're constantly shedding dander as it gets injured by the environment. Well, why don't we run out of skin? Well, it turns out in the deep layers of your skin, there are stem cells. So what happens is you have a stem cell. When there's an injury up here, we're basically running out of cells. A signal comes down. The stem cell divides into 2 stem cells. One of those stem cells goes up and turns into skin. The other one stays behind as a stem cell. So you don't run out of stem cells and you don't run out of skin.
All right. Well, let's take a break,
Yeah.
and let's come back. Let's finish on the purposes of the adult stem cells in our next segment. Folks, this is amazing stuff. Enso Discoveries. We'll be right back after these messages.
Watch Ag AM in Kansas online at agaminkansas.com.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Corey Arava, and we're here at Enso Discoveries. He's a veterinarian and has done some miraculous things with stem cells, and as we were during the break, you're kind of telling me it was a good place to take a break, right?
Perfect.
Because now we're going to get into
Yes.
what you do.
Yeah, so I said adult stem cells have two jobs. One is to keep what you've got.
Yep.
The second is repair. So if you have an injury, whether it's a paper cut or a blown cruciate ligament in your knee,
Yeah.
healing is coordinated by stem cells. Some analogy people use is they're a medical conductor. So they're standing up there with their baton and they tell other cells what to do. So they can tell one cell to control inflammation. They can tell another cell, make a new blood supply. They can tell another cell, you turn into cartilage. And then with that coordination, some jobs times the stem cell does nothing. It just leaves. Or they can die. They basically expend all their energy telling everybody else what to do.
Gotcha.
So what we do at Enso is we take stem cells from tissues that aren't going to be missed, which is mostly bone marrow and fat,
Yep.
isolate the stem cells and return them to the veterinarian to treat injuries. And then we're also working on second generation stem cells that can be more specialist for very specific applications.
Okay.
That's our pipeline.
So you're going to take fat or bone marrow and then be able to use those in areas where we need some sort of healing.
Exactly.
Okay.
So the whole principle is if we're not worried about paper cuts. In a paper cut, a small injury, the body has enough stem cells locally to fix it. But when you have repeated injury after repeated injury from working physical labor for a living, it adds up over the years, or a single significant traumatic event, they can cause an injury that exceeds the body's area to heal that local injury. So that's where we take a tissue that's not going to be missed. Nobody I've ever met would not give up fat.
Right.
Fat happens to be a great source of stem cells. So we take the stem cells out of that fat tissue and then reintroduce them to the part of the body that exceeded its own capacity to heal.
Gotcha. So it's used up its stem cells in that area or its ability to heal itself.
Yes,
so now we're going to go rob it from a place that we're not going to miss.
Yep.
And then so we go in, we take that fat out or that bone marrow out. Then what happens?
So in fat, there's about 2,000 more stem cells per gram of tissue compared to bone marrow.
Okay.
So what that means with fat is we can do a same-day process. So we can digest the fat. It's almost, think of it like plucking grapes. Imagine grapes is fat, and I'm holding the grape stem here, and I pluck all the grapes. The grapes are the fat cells. What we do is we digest the fat so all the grapes fall off. We're left with the vine network behind. So it's not fat stem cells, it's stem cells that have to be found in fat. That vine network is actually blood vessels, capillaries specifically. And there are more capillaries in fat than any other tissue of the body. First time I heard that surprised me as well.
Yeah.
And these capillaries are jam-packed with stem cells. So with bone marrow, there's not as many capillaries in there, there's not as many stem cells. So with bone marrow, if we want to treat somebody, we have to take those cells, put it into culture, and then grow more. So it takes about 3 weeks to treat.
Okay.
With fat, it takes us about 3 hours to get the cells back, and then we courier them back to the veterinarian. So they can, if they're local to us, to Manhattan, Kansas, within an hour or so, they can have the cells the same day they collect.
All right. Well, let's take another break. Let's go to commercial. But how we can do it with bone marrow, we grow it, fat, really fast, within an hour, got plenty there of stem cells. We're going to take a break. We'll come back at Enso Discoveries after these messages.
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well in their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, and we're glad to answer and work with you.
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
We are Mike and
Martha.
Armitage here at the A-Bar Ranch, Claremore, Oklahoma. We have a cow-calf production company, and we also have a marketing company. We have entertained groups brought to us by the Beef Checkoff, such as South Korean media that covered our operation and brought the good news back to South Korea.
That was a really neat experience, and that we got to have young people from another country that we got to experience a lot of different things in their culture, but got to share our culture too.
We live on the Squaw Creek Ranch here as a division of the A-Bar Ranch.
As a wife and a mother, and also with my background in more of a health field, I look at just the nutritional value, and it's great that the Beef Checkoff offers that kind of information to the consumers that are out there.
We both are proud to come from agricultural, more specifically ranching backgrounds.
My dad is a part of the Beef Checkoff board, and so the Beef Checkoff has been something that we promote and that we support what it has to offer.
Not everybody who's in agriculture is tech savvy on Facebook and through social media. Most people in the city happen to be, and they are very disconnected from our day-to-day routines, and that's one thing that makes me proud of the Beef Checkoff, them going to bat for us. From those who aren't necessarily anti-ag, but just simply don't know and they aren't getting the information.
As producers, we're strong supporters of that, and hope that many of you out there realize all of the different things that the Beef Checkoff brings to the table for us as producers.
I'm Rexanne Strew, veterinarian in Western Iowa. I have a veterinary clinic and started doing stem cell therapy on dogs in August of 2014. And after the first 2 dogs, after 3 weeks, I saw such dramatic results. I said, hey, I have arthritis, I have joints, really need this help. Where can I go to get this done? I had stem cell therapy done in November of 2014 on my finger joints, my hip, and the ball of my left foot, all of which I'd had real severe problems with. Saw a pretty dramatic improvement in a short amount of time. I would certainly recommend that somebody don't wait until I'm in the position that I was in with the damage already done to my joints. I encourage veterinarians to use it for their animals, and I encourage anybody who sees this video, if you have need, get in contact with these people, because this is a phenomenal place to have this done.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Corey Arava, and we're at Enso Discoveries, where Dr. Arava is a veterinarian, equine practitioner in the past. Still do equine practice?
I do a little bit.
Yeah, and lives up in Vermont, practices and works here with this company here in Manhattan, Kansas, right across the road from where I work. Great people, the Farleys and Dr. Arava have really taken us in and opened my eyes to some tremendous technology that is working in humans And that has proven to do the same thing in horses and dogs. And talk to me a little bit about, you know, I'm sure people are out there going, okay, I see how it works. I understand it. Now, how do I get this type of treatment, or, you know, how do I work with y'all?
Yeah, so we work with veterinarians.
Yep.
So the first thing is the veterinarian needs to evaluate the animal and determine if it's a candidate. So if it's a horse, pretty much any orthopedic injury, so that would be a tendon injury, a ligament injury, so bow tendon we call them, suspensor ligament injury, you can get impar ligament, that's around the navicular bone, arthritis of pretty much any joint we can treat. There's some other conditions as well we can treat, but predominantly we're looking at orthopedic conditions. Now the same thing in the dog. In the dog, however, most of what we're treating is arthritis. Just because we bred dogs, they get hip dysplasia, they get elbow disease, whether it's FCP, UAP, who knows whatever the cause was. Cruciate ligaments, I mentioned cruciates before.
Yep.
Dogs get blow cruciates all the time, and sometimes they don't have surgery right, and sometimes even if they have surgery, they can still develop arthritis and be painful. All of those can be addressed with stem cells. Now, stem cells does not cure arthritis. There's no cure for arthritis, but it can make improvements when no other medication can. With arthritis, we can make animals better. Some animals you make significantly better. On average, you're making them 30, 50, 70%
with
better.
the stem cell.
Exactly. And it's probably about 85% of animals with arthritis respond positively. And then within that range, there's 30% to 90% improvement. With tendons and ligaments, it's a little different. It's usually more like 80 to 90% of them do respond, but when they respond, it's usually like they respond to the point they're back in work and sound. So is the tendon and ligament normal if you look at it on a microscope? No. But is it normal from the point of view as somebody on their back riding the horse saying, my horse is sound? Yes.
That's awesome. And I can, so then the veterinarian diagnoses it.
Yep.
And then once the veterinarian, we got about a minute and we'll have to take a break, but the veterinarian, after they diagnose it, what's the protocol?
If a veterinarian wasn't sure if it was a candidate, call. I'll be available for phone consults. We have other veterinarians who are specialists for consults. If we think it's a good case, we'll send them one of our collection kits, our validated shipping containers, no charge. They can go to our website to order one of these. They can then go to our site to fill out a lab submission form. So that's where they basically put in what type of animal it is, what type of injury it is. And that way we know when our lab is to expect the sample coming in.
Okay.
With the kit, we have instructions, so they're going to put in adipose, which is fat, or bone marrow. UPS it overnight to us. We'll process it. If they're local, we'll have a courier go and pick it up, wait while they collect the fat, and then bring it back to them that afternoon.
That's awesome.
And we'll take care of the rest.
So we'll take a break now, but veterinarian can diagnose it. They can order your kit. They can take the sample at their clinic,
Yes.
mail it to you. When we come back, we'll talk about what happens when it goes back to them.
Okay.
Sound like a fair deal?
Perfect.
Folks, this is amazing, a lot of fun. I love technology. I love moving medicine forward. Thanks to Dr. Arava. We'll see you here after these messages.
Hi, I'm Kim Mandarin with Hardy Insurance. I'm here to help you with all of your farm and ranch needs. When it comes to protecting your operation and your family, you need a name you can trust at a price you can afford. Call me today or visit hardyaviationins.com.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help? How can we help?
Hey folks, thanks for joining me on today's Cattle First Minute as sponsored by Beringer Ingelheim Vet Medica. You know, when we start to think about breeding season and turning bulls out, the one thing I can't emphasize enough is to get a breeding soundness exam done on your bulls before turnout. And some of the things that can happen during the winter, whether it's frostbite in certain areas of the body or there's things that can happen that will cause a bull to become infertile, are things that you need to make sure. The other thing that's very important on a breeding soundness exam is we have to make sure that we don't have lameness or issues with the feet, because no wheels, no calves. So making sure that we have a sound bull structurally, making sure that we have one that's fertile and one that can produce enough sperm and enough volume with enough motility with no defects in the sperm is vitally important to making sure every year before you turn out to ensure that you get a calf crop, at least from the bull's point of view.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
We do business with Blueville because of the quality of their work. It is excellent quality, and because they make a commitment to their customers.
We enjoy the benefits of hiring a good company to help us maintain this home.
We will always do business with Blueville. We have for many, many years, and there's no reason for us to look for any other service.
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hey folks, welcome back to DocTalk. I'm here at Inso Discoveries with Dr. Corey Arava, and you know, when they take the fat samples, they're going to send it in and they're going to shake the grapes off of it and use what's there because there's plenty of stem cells to be used. If they take a bone marrow sample, you send it in, you grow the vine, you grow the stem cells. And so it's two approaches to getting stem cells, one out of bone marrow, one out of fat, that your veterinarian can take from your animal, mail it in one of these mailers, and now we've got them processed, you've grown, you've filtered, you've done that, and now we have the stem cells in the vial. Now what happens?
So the veterinarian is going to schedule the patient to come in.
Yep.
This is how the cells are returned, and they're chilled. They're not frozen, so they have to thaw them out. But these are living cells, so the veterinarian is going to inject them the day they arrive. And it's printed on there the date to inject by. Just like any drug, they're going to pop it off. This is actually, the outside would be sterile too. So they're going to, in a sleeve, pop it open. So in surgery, they could pop it open. If it was a horse, they'd typically do under ultrasound guidance, usually standing sedation, maybe some local anesthesia, possibly a twitch. That's it. For dogs and cats, for orthopedic conditions, they're usually either heavily sedated. So for dogs, dexmedetomidine works great.
We're just talking about that.
Or you can knock them out. Some propofol, gas. I've used Tilazol. They all work.
Yep.
So the veterinarian is going to bring if it's a dog, bring them into the back room. For all intents and purposes, we'll knock them out. Clip the area so it's easy to scrub. Do a surgical scrub, just as though they were doing surgery, but now they're just going to use a needle to inject into the structure. Some they could use ultrasound guidance, some they might use x-ray guidance. With one treatment, with one collection, they can treat multiple joints all in one day. So that's why it's always worthwhile. Call us ahead of time, we'll figure out what we want to treat and what we think the response is. The next step is what to expect. So tendons and ligaments are slow to heal. They have a very poor blood supply. It just takes time. So you don't, they might feel better within the first few days. That's just reducing inflammation. They really need weeks to months of rehab. And rehab is not just turning them out. Rehab is controlled exercise. It doesn't matter if it's a dog or a horse. It's controlling exercise and gradually raising it up. And we have printed rehab guidelines that we give to veterinarians to help them with that process.
Awesome.
For arthritis, which is more common in cats and dogs, especially dogs, some dogs, maybe 25%, will show improvement within 2-3 days. The majority, however, it's much more insidious. It's kind of like watching your kids grow. Like all of a sudden one day you turn around like, hold on, how did you get so big?
Don't limp anymore.
Yeah, so what'll happen is it'll be 3 weeks, 6 weeks, 9 weeks. It could be 3 months sometimes before all of a sudden you're like, hold on, the dog jumped up on the bed. or he can get in the truck on his own now. I almost prefer those because the ones that's better in 3 or 4 days, people are anxious. They see the improvement and they want them to. He hasn't run around the park, I want him to run around the park. We know those cells take time to work. So even the tendon and ligament need rehab for a longer period of time. Even arthritis, even if they're feeling great, they still need some rehab, but it's a matter of a few weeks.
That's perfect. Well, great work, Doc.
Thank you.
Thank you so much for sharing it with us and with our viewers. We probably have some farmers and ranchers out there that are like, hey, the dog would be great, but I need my shoulder fixed, and y'all are doing that as well. Folks, understand and get involved with the stem cell world. Inso Discoveries right here in Manhattan, Kansas. Thanks for watching DocTalk. If you want to know more about what we do on DocTalk, you can find us at www.doctalktv.com. Always work with your local veterinarian. Thanks for watching today. I'm Dr. Dan Thompson, and I'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.